Hi, my name is Hastry, and I'll be talking to you about deep vein thrombosis, also known as DVT. Deep vein thrombosis is prevalent in the elderly because of immobilization and in athletes because of contact sports. To define a DVT, it is a blood clot that forms in one more of the deep veins in the body. Usually happens in the legs, upper thigh, but can occur anywhere in the body. When you say deep vein thrombosis, you're saying deep vein blood clot. Pathophysiology for deep vein thrombosis is a blood clot that forms in the veins, but when this breaks loose, it can travel up until the lungs. That's known as pulmonary embolism. Embolism is a traveling blood clot. The lower extremity DVT results from impaired venous return, so in immobilized patients, endothelial injury or dysfunction, so after leg fractures. Upper extremity DVT results from pacemakers, injection drug use, and strenuous arm activity. Etiology for DVT is inactivity after surgery following an accident, confined to a hospital bed or nursing home, pregnancy and first 6 weeks after giving birth, recent or ongoing treatment for cancer, a central venous catheter, older age, so usually people who are over the age of 60 for not being too mobile, but DVTs can occur at any age, obesity and smoking. When someone complains of leg pain, you might want to consider a DVT. So the symptoms of DVT are pain, swelling, warmth in the area of the leg, red or discolored skin, but a DVT can also occur with no symptoms. So when someone occurs with no symptoms, they might already have the pulmonary embolism, because pulmonary embolism does have the signs and they will show them, and that's unexplained shortness of breath, pain with deep breathing, coughing up blood, and rapid breathing and fast heart rate while sitting. And only half of patients experience the symptoms of the legs. Treatment for DVT, the main goals are to stop the blood clot from getting any bigger, prevent the blood clot from breaking off and traveling to the lungs, the PE, or reduce the chance of having another blood clot, because once you have one DVT, you're usually acceptable to a second DVT. When you go to doctors, they will prescribe you anticoagulants or blood thinners. The hospital will do thrombin inhibitors, which are for people who cannot take heparin. Thrombotics, which dissolve large blood clots, but this can only be used in life-threatening situations. A vena cava filter, which catches the blood clot, and graduated compression stockings. The pressure keeps blood from pooling and clotting back. When you go to the hospital or doctors, they will prescribe, the first that they do are the anticoagulants and the graduated compression stockings. For my first case study, the title was Traumatic Deep Vein Thrombosis in a Soccer Player. It was written by Paul S. Echelon, and it came from the Thrombosis Journal. The patient was a 42-year-old male, former semi-professional soccer player. He was diagnosed with right lower extremity popliteal contusion, so he had a bruise on the backside of the knee on his right leg. A duplex Doppler ultrasound was positive for a DVT, and he was admitted to the hospital. The treatment and methods that they used in the hospital was an oral warfarin, which is an anticoagulant, and a compression stocking. The warfarin was prescribed for 6 months, and the compression stocking was used for 9 months. When you wear the compression stocking, you wear it all throughout the day except for when you sleep and when you bathe. The results of the case study were that the patient did return to soccer after 1 year, and he still complained of symptoms of lower leg pain. So he really shouldn't have, but he still did. DVTs usually do not go away, or not that easily, and once you have one, you're more acceptable to having another one. For my first article, the title was Mobility and Exercise After Deep Vein Thrombosis. It was done by H. Partridge, and it came from Journal of Vascular Surgery. The purpose of the study was to see if early mobilization could help reduce symptoms in the affected leg and speed up recovery. Since being inactive is what causes DVTs, they wanted to see if you're active after being diagnosed or treatment of a DVT, if it's better. In the past, patients who were diagnosed with DVTs and treated for them were told to rest in bed for 7 to 10 days. This was so that the blood wouldn't be so mobile and the blood clot could not break off into the lungs, or PE, but because the blood is immobile, well, not moving as much, it has more chance of forming the blood clot, so it's actually worse. The treatment was a use of a high elastic compression stocking for the affected leg and mobility. So the patients were told to walk at least 4 hours a day between 650 yards, 7.5 miles per day. This did not have to be consecutive, just at least within the 24-hour period. The results were that mobility does help the symptoms of DVT. It helps reduce the second DVT to happen, and is also better for circulation of the affected limb. So when someone does have a DVT and they are treated for it, they should be moving within that 24 hours to get the blood moving and just have better movement. My second article title was Recurrent Venous Thromboembolism After Deep Vein Thrombosis, Incidence and Risk Factors. This was written by Hastry P. Sorbo, and it was from the Journal of Archive Internal Medicine. The purpose was to see if a second DVT is more at risk after your first DVT, and to see if a venous thromboembolism is also affected by it, and that is also known as a VTE. So the methods of it was 738 patients who were diagnosed with DVT between 3.7 to 8.8 years. They wanted to see how much more DVTs they were susceptible to within that 5-year span, pretty much. So the results were that the DVT is high to reoccur after the first DVT, and a recurrent VT is even higher after your first DVT. So once you have a DVT, you should become mobile, eat better, and just stop smoking. Whatever bad symptoms you're doing, stop that. DVT and exercise. So if you live the active and healthy lifestyle, you are less likely to develop a DVT because the blood goes throughout the body and it pools everything. So you're getting your nutrients everywhere, and the blood is not being stationary, pretty much. If you have a patient who does have a DVT, have them walk as much as possible. Look for signs of DVT if someone has leg pain. So your signs again are pain, swelling, warmth in the area, red or discolored skin. But again, they do sometimes DVT symptoms don't occur until you have a pulmonary embolism. And if someone does have DVT, they are more likely to prevent it by being mobile after. And that is all about DVT. So thank you.